Heart attack versus panic attack. I wanted to do just a little deeper dive into this distinction because it can be such an incredibly distressing distinction between these two because the symptoms are very, very similar. Chest pain, shortness of breath, lightheadedness, rapid heart rate, nausea and vomiting, profuse sweating, etc. So, how do we tell the difference? Well, first of all, heart attacks in general affect middle to older age individuals. It doesn't mean that younger individuals are necessarily immune. It does mean that if you're less than 40 years old, it is unlikely that you're having a cardiac event unless you're a smoker, you have a family history of cardiac disease, you yourself have a history of cardiac disease, or if you happen to be a diabetic. So let's take a look at how these two things are similar and how they are, in fact, different. Let's start with panic attacks. So the basis of a panic attack is that it is a fight or flight response from our nervous systems. In other words, a rapid upswing of adrenaline and those type of neurotransmitters that rev the body very, very quickly. These type of symptoms can come on at any time, but they are typically brought on with emotional or mental stressors. Now, the chest pain that comes on with a panic attack is typically sharp and it's non-radiating, meaning it stays in the chest. The shortness of breath, the rapid heart rate, and the sweating, etc., is all a result of the nervous system going into overdrive. The time course is typically 10 to 30 minutes, and it typically resolves entirely. But during that time, patients frequently have this impending feeling of doom, like they are going to die. There is no evidence that a panic attack can cause a heart attack. Now, let's look more specifically at how a heart attack patient presents. Well, let's look at the basis. Number one, a heart attack is a lack of blood flow to a portion of the heart muscle. So, many times, heart attacks are actually brought on with strenuous activity where the heart rate is increasing and you are stressing the workload of the heart itself. The nature of the chest pain is very different. Patients typically describe it as an elephant sitting on the chest or just severe pressure, almost suffocating pressure that frequently radiates into the jaw, out the arm, into the back, etc. Very different than a panic attack. In addition, the pain typically does not get better over time. Again, because this pain is as a result of heart muscle that's at risk, the pain usually gets worse. And unlike a panic attack, a heart attack is a true medical emergency. Now, if you get into this situation or someone that you care about is in this situation and you're trying to distinguish such, it's always better to err on the side of caution and seek assistance from a healthcare professional to help with this situation because it really requires a blood test that checks for specific cardiac enzymes to determine whether or not you're having a heart attack. And remember, time equals heart muscle saved. So the faster that you can get patients to the hospital and that artery can be opened and reestablish flow to that area of the heart, the better the outcomes. If you enjoy this type of content, please click the link below, check out our free newsletter, and I hope you guys have a great day.